I'm Dr. Christopher Segler. One of the questions that get most often from runners is whether or not they should run if they think they have a stress fracture. So we're going to talk about what will happen if you run and you actually do have a stress fracture.
Stress fractures in the foot are one of the most common injuries among runners. In fact, stress fractures account for about 10% of all running injuries. Although you actually have 26 different bones in each foot, it's usually one of the 5 metatarsal bones that actually causes a stress fracture in a runner. Of all 5 metatarsal bones, it's usually the second metatarsal bone that gets a stress fracture in a runner. This is because the second metatarsal is typically longer and takes more abuse than the other metatarsal bones. When a runner gets a stress fracture of the second metatarsal, they're usually complaining of pain somewhere in the area indicated here. Some people with high arches may be more at risk of a 5th metatarsal stress fracture. If you develop a 5th metatarsal stress fracture, you're likely to develop pain on the outside of the foot somewhere as indicated in the circle here. Although a stress fracture is just a tiny little crack in the bone, they can bleed quite a bit, and that can lead to bruising. So if you have an aching foot with a bruise, that can be a sign of a stress fracture. If someone has pain and bruising on the outside of the foot as indicated by the gray area here, I would want to make sure that the bone wasn't broken. In fact, in this patient, the 5th metatarsal bone was broken. Based on these x-rays, we can tell that the bone has been broken for some time and the patient would have almost certainly been better off calling me and getting treatment earlier. But unfortunately, I have treated more than one runner who simply ignored all of the symptoms of a metatarsal stress fracture and just kept running on that sore, aching foot. If you run on a stress fracture long enough to crack the bone and move it out of place, you could wind up in surgery. Here's another actual patient who ignored the pain in the foot even though he thought he was getting a stress fracture. In this close-up of the foot x-ray, you can easily see where the metatarsal bone has cracked all the way across and has even moved out of position. That is actually a big problem, because once the bone breaks and moves out of the way, all of that force that was originally causing the 5th metatarsal stress fracture just shifts to the bone next to it. As a result, there is now also a stress fracture in the 4th metatarsal, which is cracking and causing another broken bone in the foot.
If you have foot pain and you think that you might have a stress fracture, you really shouldn't run on it. It's important to be seen by an expert to make sure that you don't really wreck your training and wreck your whole season just with something that might go away in a short time.
At Doc on the Run, we specialize in house calls for busy athletes in San Francisco. We run around town so you don't have to.